So my name is Dr. Shauna Burke. I'm an associate professor in exercise and health psychology, and my area of specialism with research is exercise and cancer. I work with cancer patients where we look at the best way that we can get patients as fit as they possibly can be before they go into their treatment. Physical activity has been part of my life for many, many years. So I used to be an alpine ski racer and I represented Canada. Outside of skiing, I got into mountaineering. I also run, I cycle, I lift weights. So exercise is very much a big part of my life. Back in March of 2024, I was diagnosed with advanced incurable breast cancer. I designed my own prehabilitation plan the moment I was diagnosed. So I would run to the chemo bus, I would get my chemo infusion, and then I would walk home. I also did the same thing for my radiotherapy. I would park my car 3 miles away from the hospital. I would run into my appointments, get my radiotherapy, and then I would run back to my car. It was really important for me to maintain those levels throughout, and I believe as a result that my side effects were a lot less than maybe what I would have experienced if I hadn't. And I believe as well that I tolerated the treatment quite well. Physical activity is about moving the body. It's about making sure that we're not sitting for too long and that we're moving. And that can take any shape or form. It can be gardening. It can be taking the stairs. It can be light walking around the house. Whatever shape or form that takes, it's about ensuring that patients are moving their bodies in a way that feels comfortable to them, that they're capable of doing. I like to use the analogy of wearing a suit of armor, and that's a bit like what exercise is. It helps strengthen not only the body, but it also helps strengthen the mind of patients before they're about to undergo treatments, whatever that might be, whether that's chemotherapy, whether that's radiotherapy, whether that's surgery. Psychologically, it also helps patients because it helps improve their mood, it helps reduce anxiety, and it helps give patients that sense of control. So the benefits are numerous, and they start all the way from diagnosis to treatment, right through to survivorship, and right through to palliative care. A lot of patients sometimes hear the word exercise and it can be something that's a bit frightening, or it can be a word that they're maybe not comfortable with. It can help patients feel more energized. The key thing is to make sure that the intensity is adapted to the patient, to make sure they're not doing too much. Every patient's journey is different. Every patient's experience is different. So I think it's really important when starting exercise for somebody who maybe in the past hasn't done as much exercise, is to find an activity that is meaningful to them, something that they enjoy doing. It's really, really important that physical activity becomes habitual. In order to be able to reap the benefits, it's something that needs to be done on a consistent basis. And there's many, many different ways that a person can go about being more active and moving their bodies more. Things like dancing, and there's gardening, there's swimming, there's walking, thinking just more about taking the stairs, or joining a Tai Chi program, or joining a yoga program, joining organized groups where you can go out and be with other cancer survivors. So more group-based activities can appeal to some patients more than others. Do what you can, when you can. You listen to your body, you adapt and you adjust. But it's about trying to find things that you really enjoy doing so that you add to your quality of life.